Hi, Jody here from Healing Journey, www.healingjourneyservices.com. So today I want to talk a little bit more about blood work because I think there's a little bit of confusion about what blood work normal results mean, even though you might still feel like crap. So I think this is very common for people to, go to the doctor and say, I don't feel very good at all. There's got to be something that's going to show up in my blood work. Doctor runs a full panel of tests and the tests come back normal. And people leave the doctor's office feeling a bit confused because they thought for sure something would show up in their blood work. So in order to understand why this is happening, I think it's important to take a step back and look at the role of doctors and the role of blood work. So doctors are really good at identifying, first of all, and treating disease. Okay, so that's their specialty, as well as surgeries and end-stage treatment and kind of reversing illnesses so that it doesn't lead to death, which is really important. So when they're doing blood work, they're looking for disease. So the blood work has to be so dysfunctional that it's creating havoc on the body. So when the body is, managing the blood, they're going to try and keep things as stable as possible. So you might feel like crap, but the body's going to try and balance the blood work out as much as possible so that when you test, the blood work might come back fine because the body has found different ways to manage things. And an example of this is actually an HTMA. So we look at different minerals in an HTMA, or hair tissue and mineral analysis, that might be off, but it might show up as normal in the blood work. And one of the reasons that happens is, like I was saying, the blood wants to be as stable as possible, and so it might dump out extra minerals into the hair. And so that's why we use hair analysis to get a clue of what's going on in the body. So for example, for me, my potassium on my blood work comes back fine, but when I did an HTMA, or hair tissue and mineral analysis, it actually showed super high levels of potassium. So what was actually happening is, due to mineral patterns in my body, it was pulling potassium from my cells. My blood said, that's not sitting here, and it's dumped the excess potassium into my hair. So I could tell from my hair and mineral analysis that I actually was quite deficient at a cellular level in potassium. And actually that was very true, because when I supplemented for potassium, my energy went up significantly because I was able to address the intercellular deficit of potassium. The other thing that happens when we look at blood work is that a lot of the labs, when they're looking at what the norm for blood work is they're actually polling the general population. And I think we kind of know by now that the general population doesn't necessarily represent A, what's healthy, and B, what's optimal. And so if the labs are polling a general population that's not healthy, you guessed it, you're going to get optimal ranges, suboptimal ranges that these labs are going to say are normal. An example of this is actually free T3. So I had tested for free T3, I'll just give you the value for the sake of this example, at a 2.6, okay? So initially, the healthy range was a 2.8. So when I first got my blood work back, it was flagged by the lab as low. So fast forward a couple months, I wanted to see how that free T3 was doing, and so I tested it again. Same value, so it was still at a 2.6. Keep in mind that the previous norm was a 2.8, but this time it came back as normal. Why? Because the labs had actually changed the value for what was normal from a 2.8 to a 2.6. So my free T3 didn't change. So nothing changed about it, but in a couple of months it went from being unhealthy to healthy. Now, why was that? Likely because the lab has been looking at what the norms are for the general population, and thyroid is an issue that a lot of people struggle with. And so we're starting to see the norms getting bigger and bigger and bigger. However, this is not necessarily what's optimal. In fact, when I look at functional lab ranges for blood work, my free T3 was below optimal. And so what was likely happening is some of the symptoms I was experiencing were a result of this suboptimal level of free T3. Now, is this enough for my doctor, my medical doctor, to say, yes, let's look at treating your thyroid? No. Why? Because the free T3 hasn't reached disease levels of lowness. However, what's happened is the free T3, if we look at trends for my blood work, is getting lower and lower and lower. So this is kind of reflective of what happens on an individual basis. You know, we don't go from health to disease in one day or 1 month or 1 week. This can happen over years. So I'd actually been following my thyroid blood work for years and have started to see a trend, which I'm now addressing, right? But in a month, it's very unlikely that my thyroid is going to go from normal to disease state. We're going to see that trend where it's slowly moving to disease. And so that's where practitioners like myself come in, or other functional health practitioners, because we target people in between disease and optimal. So what is optimal is what's ideal, and what's ideal is when the blood work kind of indicates that you're not going to be experiencing any symptoms necessarily. So my free T3, for example, is not optimal, and I do have some symptoms of hypothyroidism. And so that is showing in my suboptimal levels of free T3. So I know that I use thyroid as the example, but actually you can do this for most blood work. So what I actually do when I work with people is I take their blood work and I put it into different value systems. So I look at, of course, I want to look at markers of disease, but I also look at what's optimal and what's not optimal. And so you can actually see clues of where things are trending. For example, there's a marker in your liver that can show, if it's trending low, that you're actually deficient in zinc. You can also get clues from white blood cell count, from red blood cell count. You can get lots of clues on what's going on in your body based on your blood work that may look normal, but is not exactly optimal. So if you're in my Facebook group, I'm going to be listing the optimal ranges for your thyroid because I talked a lot about thyroid tonight. If you're not in my Facebook group and you want to know what these ranges are, head on over to the tab at the top of this page and you can join it. And then in that Facebook group there, you find this video, and below the video is going to be those ranges. And that will give you a good sense of whether your thyroid markers are optimal or not. If you have any more questions about blood work or other specific markers, please feel free to send me a message. I'm happy to share these values with you because I think it's really important that people start to look at their blood work in terms of, not necessarily do I have a disease, but is my blood work showing that, is it reflecting that I'm at optimal health or not? Thanks very much for joining me this evening. Have a great night.